Did a shred of confirmation that what I was saying was correct, and I got it. I was watching a video on YouTube of a doctor, Seidel, Cameron Kyle Seidel out of Brooklyn. Look it up. He said ventilators aren't working. Fact. We know that. Everyone's dying on ventilators. We know this virus is not acting like a normal virus. Pulse ox levels dip way down, and they're struggling for air. They're usually gasping. That's a fact when it's due to a pneumonia. However, when somebody's presenting with pulmonary edema, which is fluid, in the lungs, but not necessarily caused from pneumonia, they may not be looking like they're struggling for air. So Dr. Seidel said, it's bizarre. It's almost like they're presenting with high altitude sickness. High altitude sickness. Okay. Something went off in my brain. High altitude sickness. He said, I don't know what that means, but all I know is that the parallels between high altitude sickness and the coronavirus are similar. Okay. Don't know where I heard the high altitude sickness, something about mountain sickness, but we're going to put a pin in that for 1 second. So I looked up high altitude sickness. There it was, plain as day. Google it. Low grade fever, couldn't believe it. Dry cough, couldn't believe it. Dizziness, believe that. Shortness of breath, got it. Fluid buildup in the lungs, couldn't believe it. Pulmonary edema, high altitude sickness. He was right. It presents exactly like the coronavirus. 2 years ago, a doctor put a hole in my neck, literally, in the dura mater from an epidural. He made a mistake. Clear malpractice. I got a brain fluid leak. And when you get a CSF leak, a cerebral spinal fluid leak in your brain starts to make extra fluid to try to keep it full. When your body seals it and heals it, your body's still making all that extra fluid, so you go into what's called high pressure. So I would get low pressure headaches and then high pressure headaches. For the high pressure headaches, I remember there's a medicine. And something else that treats that medicine also treats high altitude sickness, mountain sickness. That's where I know that from. So I looked up the medication. I know the brand name is called Diamox, but the generic or the regular name is acetazolamide. 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 And there it was. It treats fluid buildup in the body's organs and secretes it. And I was shocked because it really targets the areas where there's common fluid buildup, like glaucoma, so that's fluid buildup in the eyes, the brain, as we know, and then specifically it targets the lungs and treats the high altitude sickness. So I'm thinking, okay, does anybody know about this? Like, shouldn't we have the word out? So I Googled high altitude sickness, Diamox, acetazolamide, the coronavirus, COVID-19, and every combination, and I came up blank. So, is nobody working on this? Hold that thought. There's a Facebook group for Diamox users. Well, not specifically Diamox users, for high pressure people. And most of those high pressure people, it's called Rebound High Pressure on Facebook. Most of those high pressure people have taken or are taking Diamox. There's over 1,200 people on there. So I thought, okay, before I say something about all this, let me just verify something, like anything, that this might be a really good correlation and a really good treatment for the coronavirus. So I posted on Facebook. I asked the moderator first, who the moderator happened to be on Diamox, and I asked the moderator first, I said, can I post this in the group? She said, yes, go ahead. So I said, hey everybody, did anybody get the coronavirus? And if you did, what were your symptoms? Out of 1,200 people over a course of days, one person responded that had symptoms of the coronavirus, and she had other respiratory issues along with it. She's taking Diamox, and she never got bad enough to go into the hospital. And she said, now that I think about it, and she's a vet, so she's a doctor. She said, now that I think about it, I think the Diamox really helped me. And I was like, I knew it. So I kept doing more research on Diamox, and I found out that Diamox is in a class. This is a little geeky. Diamox is in a class called a carbonic anhydrase inhibitor. And basically what that does is it's improving the oxygenation and the pulmonary gas exchange in your lungs. That is why the intubation and the ventilators aren't working, is because it's trying to force the air through. It doesn't need to be forced through because they're breathing and they're talking on their own. So if this isn't getting the air through, what's the ventilator going to do? It's the ventilators are making it worse. They're making everyone worse. We need to go at it in a different angle. And if mountain sickness is the way that we have to go at this, who cares? If it looks like a duck and it walks like a duck, just do it. Just try it. If it doesn't work, it doesn't work. But why are we not all over this? So I thought, okay, I'm crazy. This can't be right. So I continued to look and look. I needed something more concrete. I know I have an example, and I know I reached out to people on Diamox, but I needed some type of medical something. And I just found it, and I thought, that's it, I'm making a video and I'm sending it out. Okay, here it is. I just found it. Cure USA. It was published in Cure USA. Here's the title. Just so you know, I am not crazy. Acetazolamide, 2 other medications there. It is a countermeasure in the treatment to coronavirus. I knew it. And I just want to let everyone know there is a disclaimer, because I am not going down for this. There's all your article information. Done. I'm allowed to use this. Cited. There's a term for it. It's called sorry, I'm not a doctor, so this is hard for me. HAPE. High altitude pulmonary edema. There it is, folks. Can we... Okay. If you think there's anything to this, just pass it on. If you think I'm crazy, then delete it. But can we just pass this on until somebody says Diamox or acetazolamide is not going to work for these patients because X, Y, and Z? Fine. But until we hear that, can we just do something with this information and share it somehow, some way to someone? I don't know why this isn't getting out there. That malaria drug. Okay, that malaria drug doesn't even make sense. Something like this that targets this makes perfect sense. So why wouldn't you at least give this a try? I was ready to pick up the phone and just start calling hospitals. I sent an email to the CDC and nobody returned my email. I sent an email to some of the major media outlets and nobody has returned my email. That's all I got. So help me. What would you do if you were in my situation? That's all I want to know. What would you do?